This webinar will be recorded. If, as you're joining, please drop your name and where you're from in the chat box. We'd love to hear from you all. Again, like I said, my name is Jana Wright. I am the Consortium Coordinator for the Los Angeles County Perinatal and Early Childhood Home Visitation Consortium. We focus on getting families and pregnant women into home visiting services, and I'm going to drop the e-directory and our e-directory link to home visiting services in Los Angeles County into the chat box. So feel free to check that out as well after this presentation. So today we're teaming up with two wonderful ladies from Maternal Mental Health Now in Los Angeles County. The first is Gabrielle Kaufman. She works as the clinical director at Maternal Mental Health Now. She's a dance movement therapist and licensed professional clinical counselor. Prior to this, she directed the New Moms Connect program of Jewish Family Service of Los Angeles and has spoken widely, published articles on parenting, and served as editor for Bringing Light to Motherhood. She is the Los Angeles coordinator for Postpartum Support International and has a private practice providing services in both English and in Spanish. And our second presenter today is going to be Anna King. King is a licensed clinical social worker and perinatal mental health specialist who uses an integrative, trauma-informed approach, emphasizing the connection of mind, body, and spirit to address the whole person. She has a background in hospital social work in the emergency department, maternal child health, and neonatal intensive care units. She currently serves as the clinical training specialist with Maternal Mental Health Now, is a psychotherapist with ARC Counseling and Wellness, and is also a PhD student of Integral and Transpersonal Psychology at the California Institute of Integral Studies. So before I hand it over to Gabrielle and Anna, I wanted to share a poll with you all really quickly. And if you don't mind answering this question, it should pop up on your screen right now. So the question is, are you a first-time mom, currently pregnant, or have older children? So we'll give you like a minute to vote on this. And then please select all that apply to. So if you're currently pregnant and have older children, please feel free to indicate that in your answer. Right, and then Myra says not applicable. If that's not applicable to you, that's totally fine. So thank you for indicating that. All right, I'm gonna give it 15 more seconds. All right, 5 more seconds. All right, perfect. And now let's look at the results. All right, so we have a majority, 65% have older children, 7% are currently pregnant, and 24% are first-time moms. Thank you so much for answering that poll question, and I'm gonna hand it over to our presenters, Gabrielle and Anna. Please take it away, ladies.
So thank you so much, Jana, and thank you, Laurel. And I really want to take a moment to thank Los Angeles Best Babies Network, who came to us and said, this is an issue that we are seeing so much in our communities, so much right now, particularly at this very stressful time. And we want to do something for the mamas and dads as well in the communities that we serve. So we're really excited to be with you today. It seems like a lot of you are in the professional realm, so please forgive us. We had designed this particularly for parents themselves, but we know that there's so much information that's important and relevant. The other thing I want to just say in terms of a housekeeping is that you all have started to orient yourself with the chat box, and we are going to make this as interactive as possible, because talking at you for an hour and a half isn't nearly as fun as involving you in our conversations. So we're going to invite you to, we'll ask some questions at certain times and invite you to join and share. And I want to start out a little bit by telling you about the organization that Anna and I work for. We work for an organization called Maternal Mental Health Now. And Maternal Mental Health Now, we see ourselves as agents of change Our goals are kind of in this way. We want to raise awareness of perinatal mood and anxiety disorders. We want to support individuals during pregnancy and postpartum so that they have the most healthy and kind of emotionally supported pregnancies and deliveries. We want to talk to each parent about the importance of bonding and forming that attachment relationship with their child so that they have that attentive mother and father and grandparent or whomever that caregiver is. And we want to also help to provide that care and support for individuals in the community so that they have what they need to transition to parenthood. We know that that transition to parenting is often very challenging. And so in that way, really want to provide that support. And then finally, and most importantly, is to align efforts to support a system of care. And here in Los Angeles, and we can go to the next slide, Anna, if you can get there. We were formed in 2007 by an individual named Kimberly Wong, who at the time was a public defender for the county. And what she found is that in spite of her very difficult postpartum depression and having health insurance and well-networked and a supportive family and access to care, nobody knew what was going on with her. So she was feeling quite isolated and overwhelmed and struggling. And so in that way, it was very hard for her to find help. So she said, as soon as she got better, I'm going to reach into kind of my connections and start to build the opportunities to have services. So that was how we formed, and we've been doing this work ever since. So we're going to take a moment to talk a little bit about myths and expectations and stigma. And what we really know about stigma is that stigma becomes the greatest barrier to individuals getting the health and support that they need and care that they need. So, oops. So maybe we could go to the, whatever slide we're at, we'll go with it. What we wanted to just take a moment to think about is stigma gets kind of in the way of our thinking. We start to wonder who is a good mom and who is a bad mom and how judgmental we are. In fact, I don't think there's any time in our lives where we are even more judgmental and blaming. And so in our journeys as a parent, we find that we are often feeling not only criticized by others in the world and in the community and even by loved ones, but we can also feel really judged by our own self and our expectations. Anna, can we go to the next slide? So I want to talk a little bit about some of the myths of parenthood. And then I want to invite us also in the chat box to go ahead and add to it. So some of these myths, and I think what I want to say when I talk about myths or stigma is to say, what are the things that people tell you about parenting that aren't always true? And one of them is that sense that pregnancy and parenting are easy, intuitive, instinctive. You don't have to worry, it'll just come to you. Or here's another one, pregnant women just glow. It's just such a happy time to be pregnant. Everyone's giving you a lot of attention. You feel so good in your body. You're doing something so important. So you're just glowing. And here's another stigma that we hear often, which is a good mother doesn't get depressed. In other words, if you are depressed, you're not appreciating, you're not grateful, you're not so happy for what's going on in your life because having a baby is super exciting and happy in this wonderful, blissful time in our lives. And what the problem with having mythologies like this is they don't leave room for diversity of experience, for emotional variability, for us to kind of have moments where we don't feel great. Or somebody who might have had difficulty getting pregnant, feeling badly because I have to be happy, I wanted a baby, or I am lucky I got to have a baby, another person didn't, or my baby is healthy, someone else didn't have a healthy baby. And the other thing that contributes to stigma is this sense that if we share with you what's going on, you're going to judge us. If I say to you, you know, I'm really having a hard time, or I'm having thoughts that I don't enjoy this or that kind of upset me, you may think I'm crazy. You might say I'm a bad mom. You might call the Department of Children and Family Service or Child Protective Services, and they're going to take my baby away. In fact, I just heard a story about this the other day, that a mom who was feeling very, very, very anxious started to really struggle and was telling people about it, and the police were called in, and she was actually hospitalized. Now, she definitely needed support, but to take her away and to involve Child Protective Services wasn't necessarily what she needed then. She needed an intervention. And then for a lot of the families and the communities that we serve who are really struggling right now, really struggling with feeling like if they call attention to themselves that somebody might call ICE, they might be afraid that they will be deported if they share what they're struggling with. So we're going to do something interactive in the chat box. Go ahead and write, why do people have babies?
And I'm not going to be able to see the chat
Okay,
while.
So I'll read them out loud. I can see them. Jody wrote, they had sex. Some are unplanned. They are surprises. Some people have a calling to be mothers. Some do it because they want to continue the family lineage. Others because they want to feel loved or to be loving to someone else. Unplanned or planned, sometimes they're unfortunate events. Sometimes people have babies because of rape. Sometimes people have babies because they feel like it's the right time, or they want to fill a void. Trying to catch up. Hang on a second. Feel out. Other people do it because they want to fill the void for what they missed out on as a child themselves. Others people say they want to start their own family or raise strong leaders, or because they are feeling like they're fulfilling a religious obligation. Others do it because they want to feel loved, or keep their partners, or maybe make their partners stay, or make their relationship better. Some do it because there's a societal norm or a cultural expectation. These are such powerful responses. Thank you all, and continue to shoot them out. But what I want to say, the interesting thing about all of this is the expectations that come with having a baby can sometimes put us in a position where having that baby is expected to provide us with something that may not happen. In other words, if we are expecting that having a baby is going to change or better our marriage or relationship, that doesn't always happen. Or because it's a cultural obligation or religious obligation, but feeling maybe like it doesn't necessarily make us feel as fulfilled as we thought it might. Or if it's to fill the void of what we've missed out on as a child, we all know that that doesn't always work. So the important thing about having a conversation like this is it really allows us to reflect on what kind of feelings people are entering into as they have their baby, and to think sometimes about some of the unfortunate circumstances that might lead to pregnancy or having a baby that also exist in the background. And we want to hold on to that, and what's important about that is because we think that a lot of those expectations really feed into how that mom might be feeling or dad might be feeling as they transition into this parenting role. And is it that they feel that they're in this place that they're going to either succeed or fail or meet those expectations, and how overwhelming that can be. So let's just talk about some of the language. The word perinatal means surrounding birth. So we talk about it from conception through 1 year after delivery. And when we talk about perinatal mental health, we really want to look at this whole reproductive time in an individual's life, that we are all at higher risk for mental illnesses and struggles. Why is that? Because often the hormones that we are experiencing, those changes, our body is going through so much, our lives are going through so many changes. So we want to really pay attention to somebody at that time in general. We're also going to talk a lot about depression and anxiety for the most part, but we want you to know that there is a huge range of diagnoses and symptoms related to this maternal mental health time, or even paternal mental health time, that we won't necessarily get into today, but to know that there is a great range in terms of those feelings. So we're going to talk about depression and anxiety during pregnancy and postpartum. And something to truly keep in mind is that depression, maternal depression, isn't something that just happens in some communities. It's really broadly spread, and it can affect any woman or their partner, or a single dad as well. It can cross cultural, racial, and economic lines. Nobody is immune from this time in their lives of feeling these emotional changes. We also know that culture can have a lot to do about whether people feel comfortable asking for help, talking about their needs, talking about their emotional experiences, and can even impact the way symptoms will present. So for example, for somebody who maybe grows up in a home where they can't talk about their emotional feelings because they might be called crazy, or because messages that they got growing up may have told them that we and our family don't have mental illness, or that's for other people, or that's our business, or just go and pray and it will get better. Those kinds of messages can contribute to symptoms that might change into more physical symptoms. Maybe the anxiety might show up with increased heart rate or high blood pressure or nausea. Sometimes that depression or anxiety can feed into headaches or other symptoms. So it's not that the symptoms disappear, it's that they might look different. So when we're working with people and we're talking to moms like you, what we want to do is find out how comfortable you are talking about your feelings, what kind of treatments feel safe and acceptable to you and your community, and who's going to be part of your treatment team and community. And it might be, for example, if you are connected to a community of faith, maybe that's going to be part of your care. So we're going to take a little bit of a left turn right now, but I think it's just important for us to take into consideration how we are in this very, very interesting time in humanity, in our world. And we know that COVID-19 has made dramatic changes in all of our lives, particularly those of us who are moms or expectant moms or dads. We are noticing some great changes, and some of those will include that our prenatal visits maybe are happening less frequently, or they may be happening virtually. We know that the hospital delivery policies are changing all the time, and those visitation policies too. In other words, who can come with you to the hospital to deliver that baby? And that is something that is a moving target. Or what is the hospital going to be like when you go there? I can imagine that for many of us, entering a hospital or any kind of medical facility right now creates an elevated level of anxiety because we don't know what to expect or what risks might be there. In fact, if any of you want to write down in the chat box some of the things you've thought about or experienced when you have gone to a medical provider, go ahead and type them in, because I've noticed when you go, we first get, I know for me, you get an email from your doctor saying, do not come if you have any of the following symptoms or a fever, or if you know anybody who's been struggling. Make sure you wash your hands, make sure you wear a mask, do not touch your face, and do not bring anyone with you, and do not even come into the waiting room. So what are some of the things that those of you who have been to medical visits have noticed? And as you're doing that, I'm going to just continue to the next bullet point, but I'll be reading it as soon as you put it in the chat box. But home visiting services have changed to virtual home visiting services. And so the ways in which we used to have people come to our homes has changed. Carolina,
Yeah, Yeah, I can see the chat now. So I was just going to say to that point you were just making, Carolina says that her visits are less frequent, which causes anxiety because she just wants to hear the heartbeat and know that everything is okay. And when those visits are virtual, we're missing that human interaction and ability and comfort for the doctor to really take a look at things and make sure that things are going the way that they should be. And then Jody says that they have worked with a mom that had to give birth alone, and personally they held out on their children's checkups with the doctor's office because it's located in the hospital.
Yeah. I mean, gosh, Carolina, you bring up that sense of what are the things that those prenatal visits have always provided us with, and that sense of that reminder that during pregnancy everything is okay. And when we don't get that, makes us more prone to those anxieties. Another change that has happened is family member support. So many people have been telling us that they can't have a family member come to their home, or they're scared to have that family member come and visit, or that family member who doesn't live in town. So what happens with that? How is it that that individual can get the support that they need? Not only that kind of loving support. I have one client who tells me that she just spends most of her day crying because she misses her mom and really wants her mom to meet her baby, and how sad she is that her mom cannot meet this grandchild. I noticed that there are some notes there. If you want, go ahead and read them, Mama.
Yeah, so Lindsay is sharing that they work in a clinic, and they also held out on taking their son into their the well child check. It ended up being virtual, but they expressed some gratitude for that because it just didn't really feel necessary to expose them to that risk. Jaina says that the expectations are not aligning with the realities. Friends who are experiencing pregnancy during this time, and then friends experience pregnancy one way, and for pregnant women now it's totally different. Melanie says a patient was crying because her husband couldn't be present to hear his son's heartbeat. Jody says again that their husband is a police officer, and a few have commented that there are less DCFS visits in the community, and her husband reminded them that caregivers, teachers, etc. are not seeing the children to give the referrals at school. And not exactly that the abuses aren't happening. It's a really good point. And Melanie, what?
Want to respond to that. That is something that I know to be true, Jody, which is that it is that being locked up in home only exacerbates the conflicts and struggles that we had in the home to begin with. And we know that there's a huge increase in violence in the home, and we know that there's that violence is sometimes targeted on the children, and without having some of those external visits, those doctors visits, school visits, childcare providers, children are some children in homes are not as safe.
And Melanie asked a really good question that we could even put back towards the community. How are women supposed to prepare for delivery without their support present? Has anyone here experienced their delivery already and have some suggestions for how that went, or even clinicians or providers in the group? What conversations have you had with your clients?
Or your loved one.
Or your loved one.
While you go ahead and fill that out, I'm going to continue to go through this list, which is increased financial stress, which we also know compounds everything. That financial stress, we've been talking about furloughs and layoffs. It's heartbreaking. Businesses that are shuttering. So with increased isolation, we know that increased isolation can really contribute to depression. And with those worries about getting sick too, that creates a higher level of anxiety. So what we are seeing in just a general sense is that people who were coping better to begin with are feeling so much more pressure, so much more difficulty. So
Just a couple of comments, not necessarily directed toward how to prepare for delivery, but just commenting on childbirth trauma that can contribute to postpartum depression. Jody says that breastfeeding numbers have gone up because nurses are able to give more hands-on assistance in the hospital. And then Melanie is saying that they believe there was one incident where they were able to bring an iPad for face-to-face. Are you, Melanie, are you talking about for a DCFS visit or
I believe she's
for
talking
hospital?
how, that was answering your question earlier, which is how are people managing?
Oh, there we go. Yeah, for delivery. Yeah. So yeah, so that's one option and kind of creative way that moms are using in the last couple of months to even bring in additional support. So even if the hospital was allowing one visitor, and that might be their partner, you know, allowing a doula to still be present via technology, video chat, or even grandparents, mom who they wanted in the room to be present can visit through iPad.
Okay, next slide, please. That's you.
So we just kind of wanted to review some of the statistics. We won't spend too much time here, but there are some really important points to highlight to make you aware. When it comes to the prevalence of maternal depression, and again, just to acknowledge that we are using the language maternal or mother or mom, but we do not at all exclude fathers, and we don't exclude those who don't identify as female, but we include those who enter into the embodied feminine or birthing experience. So birthing people of all different walks of life are included in this conversation. And so, but just for the language of this presentation, we are using the words maternal and mom. So nationally, 1 in 7 mothers have prenatal or postpartum depression. And a lot of these surveys come out every few years. And so it's interesting to see how the numbers change. But over the last few years, it's been pretty consistent that number 1 in 7 is true of the US. But here in California, that number goes up to as many as 1 in 4. So if you think about the number of clients that you see in your office for the providers here today, or even moms in your peer groups, 1 in 4 of those moms are going to have some form or some degree of maternal depression or anxiety. And that those numbers are really, really huge. And so that's why it's so important to kind of know what to look out for and when it's time to really get some help so that those numbers can start to go down. And also in the US, surveys have been done on fathers that identify 1 in 10 of them also develop some form of depression. And again, that doesn't always just pertain to fathers or men. That can be a partner of any sort that can develop a mental health issue in that postpartum period. And those rates go higher depending on race, poverty, and other social factors that might be at play and compounding things. Let's see, I'm looking for my, oh, here we go. One of those social issues that Gabrielle brought up just a little bit ago in terms of violence in the home, intimate partner violence, which in the past was also known as domestic violence, is very prevalent in the perinatal period. And so some of the factors that contribute to that and the occurrence of intimate partner violence include the just overall stressors to the family unit. And so that can include difficulty with coping with the intense transitions that occur in the transition into parenthood, financial strains, big role shifts, and the impact of some of those gender and role stereotypes that that come as societal pressures on each person in that relationship. And some of the statistics say that 43.4% of assaults begin in that first pregnancy. And those can really be tied to these factors of the difficulty coping, financial strains, role shifts, but that's just to name a few. It can be a very big range of reasons, but those are some of the main ones that come up in the research. And again, the violence and abuse can come in many forms, and that can include physical abuse, mental abuse, emotional abuse, sexual abuse. It doesn't always have to be tied to physical. And when it comes to addressing intimate partner violence, it can be a very sensitive time. But what's important to know is that really safety planning is important in that period. And if you feel like you may be in an IPV relationship or know someone who is, safety planning can really help with reducing the risk in the situation, and beginning with kind of identifying and preparing emergency contacts, and knowing that there's the National Domestic Violence Hotline that's available for both men and women. There's always 911, but there's always the consideration of identifying trusted friends and family. And you know, that can also be tricky because oftentimes the the family unit kind of has similar friend and family groups and acquaintances, but the real kind of starting point there is to just identify someone that you feel safe with, disclosing what's going on for you, and then making sure that you then plan, in the case of an emergency, someone that you have on speed dial that you can call for help, especially if you have other children in the home and things like that. And to always remember that your medical provider is a resource for you. So when you're going to see your doctor, when you're going to see your nurse practitioner, midwife, whomever it might be, they have the connection to resources as well. And so there's a couple of questions here. Any ideas explaining higher numbers in California? It could have a lot to do with.
I answered that.
Oh, okay, got it. Oh, there we go. I didn't read further. There we go. So yeah, so that's a little bit about intimate partner violence. And then kind of given the current social unrest in the country, has brought a lot more light to the topic here on this slide, Black maternal and infant mortality rates. And so in the same surveys that I've gotten some of our other statistics, Black women were surveyed about their experience of discrimination. And in those surveys, more than half of Black women reported discrimination that they have experienced, compared to only a third of other ethnic groups that were included in the survey. And so this really kind of translates into an experience of discrimination that can show up in the medical setting. So Black mothers and infants die at a rate of 2.3 times more than other ethnic groups. You'll see different numbers kind of floating around. Again, these surveys are done every few years, and so they fluctuate, but regardless, the numbers have stayed right around 2, 3, 4%. Or 2.2, 3, or 4 times more than other groups. And so this is definitely a public health issue that a lot of organizations have kind of become more aware of and are working to identify. And in some of those surveys, Black women experienced the highest rate of depression, higher rates of homelessness, and a high rate of partners that were incarcerated. And so that translates to a lot of mothers who are experiencing this transition into motherhood alone without the support of a partner. And there are more studies coming out about micro and macroaggressions, which, to define that, microaggressions are really identified as or referencing the persistent stigmatization of Black people and other ethnic minorities that kind of come in the form of comments, actions, little subtleties in interactions that include a negative connotation or underlying message about that group, and assumptions made about that group. And the research that's coming out is that repeated exposure to microaggressions over time has a great impact on mental and physical wellness. And then, of course, when you get to more macroaggressions, which are more overt, then those impacts increase. And unfortunately, they're found in medical setting with medical providers. And oftentimes the micro and macroaggressions, well, microaggressions more so can occur even with well-intentioned people. And so a lot of programs right now are working to address implicit bias. And that's something that as providers, the providers that are in the group is something that's really important ongoing as working with the community. And some of those projects that are working to address birth equity are in LA County specifically. There are doula organizations and advocacy groups that are working to provide Black doulas for Black women to really address advocacy in the birthing room and in the postpartum period. And so that can be really helpful in addressing these kind of issues more head on and in terms of prevention for those lowering those maternal and infant mortality rates. So this is a chart that came from Turner Consulting Group, just to kind of give you an idea of what racial microaggressions might look like if you're not familiar. You can see that they're in quotes because oftentimes it comes across in kind of verbal form. And again, it can come from a very well-intentioned place, but in the long run, those underlying assumptions that come from some of these statements can be very harmful and hurtful. So some of them might include, what are you? Making comments about, you speak English so well. What do your people think about that? You're really pretty for someone so dark. Your name is too hard to pronounce. Can I just call you Mary? You don't act like a normal Black person. Why do you sound so white? You're not like other Muslim people. Where are you from? No, where are you really from? No, where are you really from? So if we think about it, we may have heard some of these, and whenever they're experienced, it can be really difficult to know how to respond. And so that's why it's really important to, for providers to kind of understand and know and exercise a level of sensitivity in regards to this. So this is just to give you an idea, but also microaggressions can show up in the pregnancy and postpartum period. And though they're not always directed toward racial identity, it can still have some of those negative underlying connotations. So some of those statements might look like, your baby doesn't look like you. Where is the father of the baby from? Is that a boy or a girl? I can't tell when you dress your baby like that. Do you know who the father is? So if you can maybe start answering in the chat what it might feel like to you in your body as you're hearing me read these off, what that experience might be like for you, and what that might be bringing up for you. What kind of emotions, what kind of reactions, what do you think as a as a pregnant or postpartum parenting mother? How might you react if you do hear some of these to someone who is trying to help you?
So I'll read them off.
Okay, perfect.
Maida wrote, makes me sad or triggering. Somebody said it impacts self-confidence or self-esteem. I feel judged. I would feel so small.
Yes, definitely. And I'll read off some more of these. Carrying the baby all the time makes them spoiled. Oftentimes we hear or we see differing opinions in parenting styles even. And comments that are made to us can be very difficult and increase some of those feelings of shame that kind of continues what Gabrielle was discussing in the beginning of our presentation about expectations in that period. You shouldn't swaddle a baby, it's not healthy. You're feeding her formula, don't you know that's bad for her? That's a very fussy baby, what are you doing wrong? So some of these even placing the blame on the parent about what may or may not be going according to societal standards well in the postpartum period. Any other?
A couple more people. Thank you. I just want to say thank you all for writing in the box. It definitely feels much more interactive with us. Somebody wrote, makes me feel offended, or how do I think of myself as a mother? It plays into the I am a bad mother thing, or second guessing everything that I do. And these are women who believe they are doing something wrong. These comments just solidifies that for them. Oh my God, it's so true. So if we're already feeling like we doubt ourselves, when somebody says that to us, or having a very fussy baby and you're having a hard time soothing your baby, and then somebody makes you feel bad about it, you already feel terribly. Somebody wrote, not being able to breastfeed was terrible. I was so depressed. And probably, Melanie, you write that because it might be related to feeling judged, whether you're feeling judged by others or even just yourself. And so these kinds of messages really start to beat down.
Yeah, thank you so much. Thank you all for sharing that feedback. And, even reading some of these right now, I saw someone mention feeling triggered, and this is very real. A lot of these experiences, even for some of you who have older children, looking back on your pregnancy, whenever that might have been, it can be difficult to even have to go back and revisit what some of those experiences were. So I appreciate all of your feedback and interactions here. So I won't spend too much time here on this slide, but we just wanted to acknowledge the reality of immigrants in this country and in this state, and some of the new legislation that's come out in the last 6 months or so. I think it was January, February, that the Homeland Security was provided the opportunity to test, and it's in quotes because it's very vague, depending on the setting, what that exactly means, but essentially to test the dependency of an immigrant and whether or not they're granted a visa, green card, resident status, or citizenship ultimately. But what's really important to know here for you all in this community is that public charge does not affect anyone under 21 years old, so that includes your baby and your children. It does not affect pregnant women, so you can still receive pregnancy and I think that 6 week follow-up visit under Medi-Cal. And those who have applied for a U visa, T visa, or asylum seeking are exempt from public charge testing. But what's important to really identify and understand is that there are rights, and many of the home visiting programs and as well as WIC, Women, Infants, and Children, and community-based programs are confidential and are not subject to nor affect public charge. So for the clinicians and providers out there, this is important for you to educate your clients on, and for the mamas out there, it's also, we've seen in this period that in relationship to COVID, there's some even an increase in fears with getting tested or getting treated, and then that's compounded by being pregnant. So just some information. There's more resources at the ilrc.org if you want to look into it more yourself. But just an encouragement that home visiting and Medi-Cal prenatal care, that's very important, and especially when thinking about maternal mental health, it's important to still pursue that care to really take care of your mental health as well. So we have a personal story here that we wanted to share. Let's see, can you hear it?
We can't hear it.
Okay.
As you work on the sound, though, I'm going to quickly read a couple things that people wrote. Oh, it sounds like your sound is.
Ready? My name is Marta Escudero. I'm 36 years old and I have 2 daughters. I'll share my story of perinatal depression and anxiety. This happened when I was pregnant with my second pregnancy, and at the time I was unemployed. My partner was also unemployed, and I was receiving post-bachelor education in mental health. We were not prepared at all, and the thought of abortion came to our mind, but we couldn't really go through with it. It was about the 4th month when I started feeling a lot of anxiety. I couldn't sleep at night. I was just pacing back and forth during the night. And it went on pretty much until right up to the end of my pregnancy. It was a lot of that anxiety and just not wanting to get out of the house. During the day, I slept a lot. And I put my daughter, my 2-year-old, through a lot of this, the same patterns as I was. She was sleeping a lot. I wasn't taking her out. There was thoughts of even jumping a bridge with my daughter because I didn't want to leave her alone. So I thought maybe we should just end it. Like, these thoughts came, and I knew that I was going to follow through at the time with them, but they did come often. My partner was also going through anxiety and depression himself, but it manifested in a different way. He just didn't want to deal with it. He wanted to avoid it and not talk about it. And what he did was not be home, which made me angry because I was depressed and I felt like I was stuck at home. So he was not home, and this caused a lot of arguments and fighting, and even like thoughts of, oh, he's cheated on me. Where is he right now? Things like that. They were just like delusions, I guess, during my state. But you know, it just made our relationship a lot more difficult. I had a lot of blame and guilt towards like just not being there for my daughter and for my unborn child, having put her through all this. I mean, I studied psychology. I knew something was going on, but I was just so deep, like I felt like I was in a hole, like in a deep, dark hole that I couldn't get out, and I couldn't seek any help. At least professionally, thank God I was able to seek help in other ways. In the Latina community, there's a lot of stigma regarding mental health. Nobody wants to talk about it. Everyone thinks that if you have a mental health issue, you're crazy, your kids are going to be taken away, you're going to be in an institution, so you don't mention it at all. And it's really difficult for us to seek help at all and to voice out what we're feeling because there's this fear of our children being taken away. En la comunidad latina hay mucho estigma y miedo en decir que tienes depresión, ansiedad o algún problema psicológico porque piensan que que estás loco y que te van a llevar a la casa de locos y a tus niños te los van a quitar. Entonces la gente no quiere recibir ayuda, no quiere ni siquiera decir lo que está sintiendo, todo se lo traga porque si lo dice, tiene ese miedo, tiene un gran temor que sus niños no los van a ver. The one thing that helped me was that I did reach out to friends and family, even just to cry or vent, and they were able to offer some suggestions that sometimes helped, such as just drinking warm tea, or they would drag me out of my apartment and, you know, let me see the sunshine or walk a little bit. And then they also helped me with like encouraging me to journal and voice my feelings if I couldn't reach a person, to at least do it by myself. That helped a lot. And a lot of friends, they also organized a mother blessing during my pregnancy. And this was really important. It was a big change. It helped both my partner and I, because I think he just felt also like in a deep hole, a dark hole, and he didn't know how to provide for the family. We were both unemployed, so he felt like he was a failure as a man, as a provider. And in community, when our friends and family were able to state, we're here for you, you know, whatever you need, we're here. He was able to see that, that sometimes, even if you're a man, you can't do it alone, and it's fine to seek help, and it's fine to receive it. And we were able to be open to receive help, and that helped heal our relationship as well. So after all this dark period, a lot of light came. I was able to find a good job during my postpartum period. Also, they organized a community effort of support where they provided childcare, they did laundry, housework, they brought me teas and meals, and I was able to have like all the support every mother pretty much deserves, and I felt really blessed. At this time of my life, I think motherhood is a blessing. I think my daughters really helped me become a better person every single day. I think if you have support, motherhood can be very beautiful and very hopeful. You're creating the next generation, and that's an awesome job. If I were to talk to a new mom, I would tell her that mothering is very challenging. It's not as easy as sometimes it seems to many people, but it's also very rewarding. And sometimes it's okay to be sad. It's okay to be sad, and if that sadness stops you from bonding from your child or from enjoying other things in life, then you should be unafraid to seek help and to tell people, tell everybody, and find somebody that's able to listen to you. A las nuevas mamás les recomiendo o les aconsejo que sí es difícil ser mamá, que no es tan fácil como quizás algunos tienen en mente, pero también es muy hermoso. Y que está bien que esté triste de vez en cuando. La tristeza es una emoción natural y normal, pero si esa tristeza afecta a usted haciendo sus cosas cotidianas o a disfrutar a su niño y a su vida, entonces es importante que busque ayuda o que le diga a alguien, a todos, a quien sea, a alguien que la escuche y pueda proveer algún tipo de ayuda. Sometimes it is difficult to tell your story because you feel like people are going to judge you as a bad mother. To me, it's important to tell your story because during dark times, you often feel alone. And when you hear somebody else's story and you're like, wow, I'm not alone. There's somebody else out there that feels just like me or felt just like me, and they were able to overcome that. That gives you hope, and it gives you a sense of community, and it reminds you that you're not alone, that there's a lot of people out there that you're human, that everybody feels that way in a certain time, and it's okay to seek help, and it's okay to feel like that as well. Speak up when you're down because it gives hope.
So if anyone wants to share any reactions or feelings that you had as a result of hearing Martha's story, feel free to put that in the chat. We're going to move on to Gabrielle to share about risk factors.
Thank you. Okay, we can go to the next slide if you don't mind. Thank you, Anna, for moving things forward. Okay, so what we want to talk about with risk factors, and I think I want to be really clear about this, is that a risk factor doesn't necessarily mean that if we have a risk factor that we are definitively going to have a postpartum depression episode. But I think what we want to do is instead look at it as how can we pay closer attention to how we're feeling and what's going on in our histories. So we want to think about what is my family history, what is my personal history of depression, or even a postpartum depression or anxiety. And sometimes people and families don't talk about it. So what do you notice? Did you notice that someone in your family seems sad a lot, that someone in your family worried a lot? You also want to talk about maybe a family or a personal history with kind of menstrual struggles. Is there pain or hormonal shifts or kind of an emotional change that happens during your menstruation or leading up to menstruation? Fertility, kind of a fertility journey that may also include a fertility loss, a miscarriage. conflict in your family, conflict in your home, interpersonal stress, or an unsupportive partner. All of those can even include violence, not necessarily, but can create a higher risk for developing a depression or anxiety. A past experience of any trauma, and what we've really noticed is that trauma is a very personal experience. So for what for me feels traumatic may not be the same thing that you feel is traumatic. Physical, emotional, or sexual abuse for yourself or for you as a child or in your home right now, or even drugs and alcohol that you may be using or that a family member might be using, or even low income and financial strain can be a risk factor. And then we want to think about losses, and those can be risk factors too. And we think about death. It's not necessarily did someone just die, but how am I impacted by it? And could it be someone very close to me, like a parent, or could it be just somebody in the community? And I'm going to say something really interesting, which is we have been hearing in the news about some really brutal deaths at the hands of police officers, and those might be really impactful to our feelings of safety in the world. So that alone can contribute to being a risk factor at this time. And complications with health during pregnancy or birth. And that might be a baby that's in the neonatal intensive care unit, or ourselves who have gestational diabetes or have tear during pregnancy, or even an emergency C-section. All of those things can be higher risk factors. And like I said, with a higher risk factor, we just want to be particularly sensitive to ourselves when we're going through them so that we know how to ask for help.
Well, we had a few responses to that video. People just saying they appreciate her honesty and attempt to destigmatize maternal mental health. And Melanie says that she appreciates that she said it's okay to be sad. Some women feel like being happy is a sign of being a good mother and that they can't be sad. And it was nice that she normalized that. That's really important. And then Erica identified the fact that she talked about her male partner's simultaneous depression and anxiety that was occurring at the same time, and that it has an impact on the family and it sometimes goes unrecognized. So some good responses, and we're glad that you were able to get some good stuff out of that story. We have more on our website. I put the website in the chat for you to check them out if you want.
Thank you, Anna. And in a way, that same comment about the partner's depression, again, that goes to, is there a loved one in our family who is struggling, because it's going to impact us. And to that end, we want to look at these populations, and I think all of us can see ourselves and the people that we might know and work with in these populations, from adolescents or teens, single moms, people who are either in the military, or moms who are in the military, or who have a partner in the military or a loved one in the military, people who are struggling financially or socially isolated, or new immigrants. Or this is another thing I've noticed, is it might not even be a new immigrant, but if your family is in another country, and let's be honest, there's no international travel at all right now. So you cannot be seeing those family members who are far away. And as I talked about, women with high risk pregnancies, fertility, loss, parents who have a baby in the neonatal intensive care unit, and parents who are LGBTQIA, lesbian, gay, bisexual, transgender, queer, intersex, and asex plus. And those communities are at higher risk. And then just something to add to make to spend a little extra time here for a moment, which is that miscarriage, stillbirth, and infertility really are powerful losses. And maybe if you can quickly in the chat box write some notes about what are some of the things that people who might be well-meaning but not so sensitive say to somebody who has miscarried, who has lost a baby. Because I think all of that adds to that shame and blame that we feel, or that doubt, guilt. And we always need to make space for grief, because when you have lost something, it is so painful. So I already see people are writing if you want to.
Yeah, We've got Myra said, you can try again. Dawn said, God wanted your baby more. Renee said, maybe it wasn't the right time. Myra says again, it wasn't meant to be. God had other plans. You're young. What did you do to cause the miscarriage? So putting the blame on the mother or parent, birthing person. You're young. You can try again. Your baby is an angel now. Something must have been wrong with the baby. And you have other children. So all of these, what quality do all of these have? They're very dismissive of the actual experience that that person experienced a loss.
I want to say something I noticed as we put out a couple questions too to put in the chat box, and this is the one you responded to the fastest. So I think we are all very familiar with the ways in which people say things, and I actually think when people say these things, they mean to be comforting, but they're not comforting. They just shut us down. They make us feel badly about ourselves. They maybe feel like we are blamed, and even the idea of God wanted another angel doesn't necessarily feel comforting to everybody. And so what is the best thing we can do when someone is miscarrying is we can say to them, wow, I'm here for you. That's a painful loss. So yes, Melanie wrote, some people are just uncomfortable. They want to say something to fix it. And we're going to get to that in a moment to talk about how we can be better at that. And just one last quote related to this, which is some people even think that if they just have another baby, everything will feel better. I thought having a new baby would make the sad feelings from my earlier miscarriage go away, but I was wrong. Because we know that loss doesn't just get swept under a rug. We do need space to grieve. Yes, and Jana wrote, the responses don't give grieving parents the time to feel and process. And Linda wrote, it's better just to listen. Okay, Anna.
So when it comes to really what to expect and what to look for when it comes to maternal mental health issues in the perinatal period, there are always an expected range of emotions that are likely to come up in those first few days and weeks. It's okay to have, you know, a little bit of both of these categories, positive feelings and negative feelings. That's all normal. And it's also normal for them to ebb and flow. So some days you might be full of, you know, joy and love with, you know, a little bit of some overwhelm, but then the next day you might be full of exhaustion, feeling distant from everyone, and really just struggling to find that those deep feelings of joy and connection. And so when it comes to identifying at what point do we feel that it's, you know, maybe time to get help or time to reach out, then it's really time to start looking at the way that it impacts the way we feel every day. And when is it weighing really heavily on the negative side for a consistent period of time. And so we've all heard of baby blues. It's something that it's a term that's passed around a lot, even by providers. But really, it's quite common. It happens in 50 to 80% of postpartum women, but it can vary in the way that it shows up and presents depending on the cultural community, cultural norms. Some of those we've talked about, some of the factors we've talked about already. The symptoms in baby blues can happen immediately and last just for a few days, or they can last up to 2 weeks. But the really key thing here is that they go away. They usually go away on their own. So the takeaway is that the symptoms are mild. It's short-lived and it goes away on its own after 2 weeks. And really there are a few things that can help when baby blues comes up. And I think some of the research says that the baby blues is really due to that intense shift in hormones at the time of delivery. And so with anything we experience, there's a big transition, and physically there's a transition our body has to go to, and then mentally, mentally and psychologically, the transition into taking care of this baby, whether it's your first or second, third, there's always a transition. And so some of the things that have been shown to be very helpful for baby blues is getting sleep when you can, paying attention to nutrition and eating regularly, even if that's small bites throughout the day, reaching out if and when that time comes, but also not being careful not to wait too long for things to get better. And so we'll get into some of the specific symptoms, but the characteristic of baby blues is that even when the symptoms start to err on the side of kind of negative emotion, you're still able to find those feelings of joy and contentment in between. So it can look very similar to postpartum depression, including symptoms of crying, anger, sadness, sleeplessness, anxiety, exhaustion. And again, it's okay to have all of these, some of these to some degree, but what makes them different from postpartum depression is again, in the way that it impacts you and your feelings every day. And again, it really usually is concentrated in those first 2 weeks. However, postpartum depression can also start before in the pregnancy and even right around delivery. So that's why it's difficult, because there's a gray area, but really knowing, not waiting for too long before getting help is what's important. So some of the language of postpartum depression that is helpful to kind of know and recognize is kind of some of these listed here. And again, you can maybe write some of your responses as you hear these in the chat. So someone might be saying, no one has ever felt as bad as I do. And that might be showing a sign of some feelings of helplessness. I made a terrible mistake. So maybe some feelings of, maybe I'm in too deep, or I've got, I'm so overwhelmed and anxious that, I'm feeling like I've made a mistake in having a baby. And this can be particularly conflictual for someone who may have wanted a baby and tried for a baby for a long time. And when that actually comes to their experience and it's overwhelming, that can cause some really conflicting feelings. I'm alone and no one understands. Big feelings of isolation. Isolation is one of the more significantly impacting factors to perinatal mental illness. And as Gabrielle outlined earlier, currently during COVID-19, isolation is at an all-time high because we literally can't get with other people. I'm a failure as a mother, woman, and wife, revealing some maybe underlying feelings of guilt and poor self-esteem. I'll never be myself again. I'm losing it. I'm on an emotional roller coaster. Some of these showing feelings of mood shifts, feelings of hopelessness and despair. I want to cry all the time. Everything is an effort. So feeling like you just don't have a lot to give every day. Feeling like you're in a fog. That's one I've heard a lot. Really feeling that disorientation and confusion, and not able to keep up with, taking care of yourself, taking care of the baby, and taking care of a family. And sometimes I think everyone would be better off without me. And that can be maybe along the lines of explaining some or alluding to some suicidal thoughts. So, not to, make it so that if you have any of these thoughts, it automatically thinks that you're having, or it automatically means that you're having postpartum depression, but just some starting points or ideals to give you some keys into, maybe when you start to realize that you're just not feeling like yourself, it might be time to reach out and talk to a professional and kind of see what's going on there. And I see that we've had some responses here. Melanie says they're uncomfortable, so they need to say something to fix
Yeah,
the situation?
I've already read some of that, so don't worry. I think we can move on. But Jody just said something. I think it's healthier to stay home right now, which can be hard with COVID. So, but
Yeah.
the other ones we had already read.
Got it. So these are some of the more identified, commonly identified symptoms of postpartum depression, just to give you an idea. And again, everyone is very, very different. No two people and their situation is ever going to look the same. But just to kind of give you an idea of themes of symptoms that have come up in the past, difficulty sleeping, weight loss, difficulty with coping, some of the phrases that we just read off, alluding to feelings of hopelessness, confusion, difficulty concentrating, or this is really common, just feeling like you're going through the motions, and so feeling maybe a little bit of that disconnection to the actual experience. You're able to get up and do what needs to be done for the baby, but you just don't feel present. Feelings of failure, sadness, forgetfulness, fears of being left alone with the baby. This is common. Overwhelming anxiety, and this is a key one that oftentimes we don't realize, is that anxiety can be a very, very key symptom to postpartum depression. Although anxiety is its own separate situation, it can be a kind of an indicator that there might be some postpartum depression occurring. Difficulty bonding with the baby, and of course, suicidal thoughts. So if you'll notice, symptoms of anxiety, this list hasn't changed much from the previous slide. That's because oftentimes postpartum depression and postpartum anxiety can look very similar. They can come co-occurring together, but they still are very differential when it comes down to different treatments and how they present themselves. But again, really it comes down to not necessarily this you having to remember the specifics, but really if you're just not feeling like yourself, don't wait and reach out to someone, to a professional that can help you kind of identify if and how to address it. And as we've already identified, partners and dads can have postpartum depression too. It just often looks a lot different. And so we heard in the video with Martha how it presented with her partner, and some of the common themes of symptoms for dads includes a loss of good sleep that can contribute to them feeling depression, a depressed partner. And I think the statistics is that if the birthing person or mom is having their version of perinatal postpartum depression, the risk is about 25% for the partner. So that's very high. Conflicts in the relationship, isolation is another big one for partners in those role shifts. Partners oftentimes have to adjust to their role in the family as well. And then if we know that cultural influences impact the way that dads kind of see themselves, or partners see themselves in relation to mom and baby, and you might see dad getting angry easily, or expressing feelings, or even showing symptoms of burnout, and maybe even turning to some complicated coping mechanisms like drugs or alcohol, needing to escape with, video games and things like that. And really, it's seeing the shift from before and after that you can really tell that something is up with the partner. And also experiencing difficulty connecting with the baby, and economic problems or limited resources. And so in some cultures, partners hold the role of needing to provide. And so when a baby comes along, babies are not cheap, and oftentimes bring their level of stressors that impact dad as well. So just to kind of identify that. And I will pass it on back to Gabrielle.
Okay, everybody, I am also aware that time is flying because we're doing so well here. So let's go to the next slide. I'm going to go through these relatively quickly, and our hope is afterwards, if you have more questions, you'll let us know. So why do we care about depression during pregnancy and postpartum? And that's simply because everybody is impacted, from the mother to the fetus and the baby and that attachment relationship and the family, the partner, and the society. Let's go to the next slide. And one of the things we really want to work on is building that strength so that the family can weather it, so that we have the education we need, the support we need, the ability to talk about our story, kind of like Martha did, the ability to ask for help, and even be able to receive help, which is a skill not everybody has. And we want to look at where are those supports, and they might be community, they might be faith-based, they might be it might be really important for us to know that people have access to health care. And I want to look for a moment at the word forming positive attitudes. None of us need to say only be happy, but to try and help people problem solve and troubleshoot. And so once we can listen to their feelings, we can get there. We're going to show you a short video, and then I'll jump right back.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. Yeah. And we do it all the time, because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now. I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
So at any rate, that's Brene Brown, and you guys can find that on YouTube. So let me quickly go into what are the things that we can do to help you get better. And some of the things are going to be being a good empathetic listener and helping somebody to be there for you in that way. The others are some basic healthy life habits, including helping somebody get some rest. And it's, of course, not an easy thing to say to somebody who's a newborn baby, just go sleep. Well, we might want to say, how can you ask for help so that you can get some rest? Nutrition, again, and that doesn't mean that it has to be a complicated meal, but to sit and to figure out what are quick foods that are going to be nutrient packed that I can quickly grab. And exercise, which doesn't mean that you're going to have to, so many gyms are closed, not like you have to go spinning right now, but what would it be to help somebody figure out, or yourself, how to go for a walk? Another thing that's really helpful to get better is reaching out for support, and it might be to your faith leader, it might be to schools if you can, to family, or to kind of the integrated care, and what that means is your providers in your community health clinic. But we also know that right now those things are harder. So that's why home visitation programs are really essential, and those home visitation programs should be screening you, giving you some support, even if they're not in your home. Group therapies can be really helpful, and we are offering a group therapy, and at the in a couple minutes we'll show you the slide for that, and we can forward that to people. But group therapies aren't for everybody. And individual therapy is sometimes really helpful for depression, and parenting classes can be really good too, or parenting workshops or therapies, and here are a bunch of them that might be available to you in your community. And in some cases, medication can help us to get better. And medications can, I guess we can go to the next slide because it talks about it. Medications, oh, I guess not this one, but medications can be safe during pregnancy and breastfeeding. Just talk to your doctor about that. There we go. There's that slide. Thank you so much. Somebody wrote, we want to remind moms that they're not a bother, and people are so happy to hear from them. And I think this is why it's hard. We are women are often taught that we should be really independent and shouldn't need help from anybody. But I think asking for help is an incredibly important skill that not only do we want to possess, but we want our children to learn that too. Some resources may be part of our creative research, like are they in your community? It could be a prayer-based mom circle, a mommy and me class that's online. It could be family support. Again, might need to be virtual right now. School, parenting education courses can be extraordinary, and many of them are available. WIC offers not only breastfeeding support groups, but other informational groups. Best Start, we know about Welcome Baby and other, and nurse family partnerships and other home visitation programs, and Parks and Rec. So again, even though we know that for some people they're going to need maybe therapy and medication and real professional interventions, sometimes what we need is a community support. And here I'm going to quickly go through this too, which is just other things to find supports: infant massage, what is in your medical home in terms of courses, hospital prenatal classes, and breastfeeding groups, which by the way have all gone online now. I already mentioned home visitation, regional centers for children with special needs and for parents of children with special needs, school-based healthcare, Healthy Start, pediatricians sometimes have in-office social worker groups, and neonatal intensive care units have many support groups. There are also support groups for people who have lost babies or miscarried. Next slide. And things to keep in mind in terms of breastfeeding, that we know that breastfeeding can have so many good things that help us with depression. They can help us with that mother-infant bond. It can help with the release of oxytocin, which might make us feel better, might shrink our uterus, and have anti-inflammatory effects. So breastfeeding can be extraordinary. And if that is what someone wants, we want to give them any support that they need. But sometimes people can't breastfeed, or sometimes that breastfeeding is painful, or they're not producing enough milk, or they have shame or guilt related to it. So what we want to do is ask them, if this is what you want, how can we provide you support? And if you cannot do it or choose not to, we will not shame you. We will help you to explore healthy options so that you can get a healthcare provider or somebody to get you some help with that. Next slide. So finally, we really want to tell everybody you're not alone. You're not to blame. And with the right help, you will get better. And that's so important, right? Because that isolation we talk about is so true, but then we've talked so much today about blame. So getting help is all the difference. Okay, Anna, it's all yours. Take it home. And we're going to skip Pilar's story. We don't have time. By the way, as Anna said, there are more stories. We just don't have time. We have about 5 minutes, and we want to get you through this in time.
So we wanted to share a couple of resources that are available for you that we have created on our website. You can find it at www.directory.maternalmentalhealthnow.org. This is based in LA County. We have providers that add themselves to our directory when they offer maternal mental health related resources, and it is now updated to indicate whether or not that provider offers telehealth. So if you just go to that website and type in your location, then you can find hopefully a couple of options in your area if and when you decide you want to reach out to someone for some help, assistance classes, etc. I don't think it's isolated to just therapists. There are also other community organizations listed there. And the group that Gabrielle was mentioning earlier, myself and Gabrielle co-facilitate the group for moms on Tuesday afternoons at 2 p.m. The flyer says that it's only through July, but we just recently got approval to continue through the rest of this year. So if you're interested in joining us, just reach out. You can send an email and we'll get you that information. We also offer the same group in Spanish on Tuesday afternoon at 1 p.m. and it's completely free. You can come to drop in at one, you can come to all of them. It's really up to you and we'd love to have you. We have a great group that's been coming pretty consistently and we really would love to see you there. We talk about just all of the different challenges that have come up in this difficult time related to COVID-19, and even if there's other issues that are coming up, issues, challenges, we discuss them as a group, and it's been really helpful. So let us know if you're interested in that. Now we have an emotional wellness self-help tool. This is a web-based app. You can find that at mycare.mmhnow.org, and we wanted to show you how it works. You can even pull it up if you're at home and you have your phone. Pull it up right now. Just type in mycare.mmhnow.org, and we'll just check it out really quick. Let's see if I can get there myself. Okay, so this is the home screen that you'll come to. It's split up depending on if you're thinking about having a baby. Can you all still see it?
Yeah, yes, we can see it.
Perfect. Okay, I just wanted to triple check. If you're thinking about having a baby, if you're already pregnant or you've already had your baby, so we'll go the route that you're currently pregnant. So once you click on the route that you want to go, you'll be taken through some psychoeducation and even some activities here. You can use these to just think on, meditate on, or you can use them as a journal entry guidance. So some of the questions here in this activity include: write down what you envision motherhood to be like. What kind of mother do you want to be, and what motherhood traits do you want to avoid? And you can write those down and maybe reflect on them with someone else, or even just kind of keep them and revisit them after you had the baby, and it'll give you kind of an idea of your journey into this transition. Here is some scripting that's important to note if and when the time comes that you might have to ask for help. Some things that you can say are: I'm not feeling like myself. I think I need help. Can you help me find someone to talk to? Or I feel so alone in my feelings. Do you think there are other people like me who are having a hard time being pregnant? Can you help me find them? So any provider, your doctor, the nurse at the clinic, even a peer, someone that you trust to help you navigate this, you can kind of say these things and communicate that you might want to look into getting some help. I'll skip through and get to some of the managing stress section. So this is more psychoeducation on the website that you can read through on your own time. But what's important is that, you know, not all of these are going to apply to everyone, but it's good to know and reflect on how stress and anxiety shows up in your body. And this can lead you through identifying some of those ways so that you can know how to address it. And then we'll take you right now through a quick little breathing exercise. So if you want to just find a comfortable position and just watch on screen, it's going to take you through, we'll do this maybe just 3 or 4 breaths, but just follow the prompts and inhale and exhale. And your breath, the inhale, your lungs should match the length of time that the inhale is expanding, and then when you exhale, it should match the circle shrinking down. And this is something you can pull out if you're having a moment of overwhelm or you're feeling like you just need to ground yourself. This can help. And also this activity we have identifying and tuning into your 5 senses. So it'll take you through identifying something you hear, something you smell, something you see, something you taste, and something you feel. So
it's 1:30, so we have to finish up. But what I want to say is that this app is available. It's a web-based app. It's available to everyone for free, and we're almost done with the presentation. I see a couple questions there. So people are asking whether the presentation is going to be available, and I'm going to just let Jana, I think it might be posted. You'll have to say that. But I'm so sorry, Anna, for interrupting you. But thank you all for sharing this afternoon with us. Thank you, Los Angeles Best Babies Network, for sponsoring this. And we really hope you enjoyed. And if you have more questions, we're excited about that because it means you're still, learning and trying to build from this. And the presentation will be available at below the link is on that chat box. So go for it there. Thank you, everybody.
Thank you so much. I'm going to end the presentation now. Thank you for joining.